welcome back. If you're just joining us, we are still live in our election studios on Plus TV Africa, and we have been talking about the health sector in Nigeria as we gear up for the governorship elections this weekend. What should these candidates prioritize, especially when we're talking about the health of the people?
Well, they definitely have to look at health as a very important sector, and we must have investment, big-time investment in these areas. And joining us now this time around to talk about health, we have Chioma Wankama, the founder, Smile With Me Foundation. Thank you very much for joining us.
Thank you.
We also have Dr. Olani Ayodeji, a medical practitioner. Good evening.
Good evening.
It's good to have you join us. So I'm sure you were listening to the conversation we had prior to now. Of course, the issues are so many. There's so many. It's a potpourri of issues. But let's start with you because you're a general practitioner, you know, something we would call a GP. As a person who's in the business, why do you think that the medical or the health sector is as bad as it is? Because I don't think there's a better way to put it. It is bad from all of the things that we see. And if you were listening to me, you go to a hospital with somebody who has, let's say, for example, a bad heart, and the person comes home with malaria because there are too many mosquitoes. You know, you sometimes have to go through a very rigorous process. You have to go buy your gloves, buy your syringes, and so you really wonder, what are you paying for in those hospitals if you have to literally bring everything? Why do you think the sector is this bad? It has deteriorated over the years, hasn't it?
Well, thank you very much for the question. If you say deteriorate, I will say yes. But if you say bad, I don't know how to quantify it in your terms.
Okay.
Well, the health sector in the state has taken a new form, actually. And there's what we call community-based insurance scheme that's been ongoing now. And I think the government in their magnanimity had been able to reach out to the community and members of staff working with Lagos State government especially, put that as the point of contact here. And they've registered almost everybody to have that national health insurance scheme cover on community base. Now, out of pocket is actually what the problem is. You go into a place and you have to bring money out of pocket. We know the earning power of an average Nigerian is very low compared to the minimum wage and what is being proposed. You still can't afford quality healthcare service. Even in countries like the United States of America, for an ambulance service to come up to you, you could pay as much as $200. Do you know that what that means? That's a lot of money. That's 2 days' wages or 4 days' wages of hard work just to pick you to the center to receive care. That's not the cost of care. So health is very expensive over there. So when you see people come up with free health care, I'm coming to the hospital, I expect government to give me drugs. Well, we'll get there one day. We'll get there someday. It's a slow, steady, but painful journey.
How long do we have to wait?
Just like the old saying, Rome was not built in a day.
Okay, if Rome wasn't built in a day, and you touched on out-of-pocket expenditure, which we're currently looking at around the threshold of 64%, how do we, in the next 4 years, bring down this figure relatively to about 50%?
Even with what is on ground now, I've told you earlier, they've taken a giant step to register members, where you get to choose certain hospitals, even the private ones and the government ones, and you're paying the same fee for community-based insurance scheme. The state has already inaugurated that. They've started. So people are already visiting these hospitals.
How is it being funded?
Now, this is it. There's a certain amount that will be deducted from your salary every month. So it's like a pool. Not everybody will go to hospital at the same time. But when the pool of funds are there, they can be able to afford services and the goods needed. So when someone visits the hospital, it's at almost no cost, as long as it covers the scope or within the medical scope what you're there to.
So that covers
receive.
Only a man or a woman who's working.
A man,
what about
a wife,
the people
and the
who,
family.
And most likely those within the civil service.
The retirees. What about the veterans who no longer work? These are people who need more medical care than the man who's still working. You and I were still very active. But those people, how do they fund it? Because they also need access to that same health care.
Yes, well, it's a pity because most of these innovations came into limelight in the last 10, 15 years. And we're yet to even achieve probably 30%. That means coverage. it's less than 30%. That's around the whole country. I think in the next future, people like that will put into consideration.
Now, quickly, Chema, weighing on this topic now, we know financing of the healthcare sector has not been what it should be. We've still been lagging behind, just single and a little bit at double digits, that's below, not in close to 20%. Now, how are we supposed to create a structure that works for the next 4 years? Dr. Olani spoke about community-based insurance scheme, but what other steps can we have, especially when it comes to political will? Because there's a disconnect between how much we understand that health is wealth and how much government at state level is willing to bring out of its pocket to support this.
Okay, I think I'll firstly say thank you for the question. And as Dr. Ulani said, at least the Lagos state government is coming up with structures and things that we believe, because we need to be positive, we believe is going to help the masses. Now, to the question, health financing, I like to say the issue, as you mentioned, is lack of political will. Over the years, we have had promises, a new government coming in, and they have, really rosy schemes and promises, things that make you really excited. But the problem we've seen consistently is when it comes to execution. So we have beautiful structures laid down on paper. We hear we're going to implement the NHIS. We talk about the primary health care. We hear we are building more structures, we're building more centers. I think the problem is not quantity at this point. The problem should be quality. So if you have 100 primary health care centers, how many of them are well structured? How many of them are equipped? How many of them are ready to receive emergencies? So I think Nigerians are tired of hearing we are going to build more, we're going to increase. We want to hear quality. So we need, for us to move to the next level in healthcare, I think implementation of what has been is one thing that should be started. We need people who implement. And then secondly, when it comes to health financing, I think it's a really passionate area for me, because I feel the Nigeria I've been seeing, the government, starting from the federal parastatal, it's like health is not given its place. I believe if you want to rule a people, it should be people who are alive and healthy. When people are alive, they can make better decisions. They can even vote better. So I think.
But I'm sorry to cut in.
Yeah.
The average Nigerian is trying to get food on their table. So trying to convince them, and I'm talking about, let's just say if it were to be a contributory, NHIS or insurance policy, you would hear something like, "I never chop finish." You're asking, So how do you even get past that mindset? To get the people to see that if you drop 1,000 naira or more every now and again, before you know, little drops make a mighty ocean.
Yeah, the issue, it's not even the people. For me, at this moment, I know that the people play a major role too. It's mutual. But my issue is, has the government done its part? Because talking about financing, telling people to get, some people, 1,000 naira to some people is like, it's gold to some people. Some people haven't seen that in a month, believe me. And so telling someone to drop that is not so ideal in a country that we're hearing that Nigeria is the poverty capital of the world. Yeah, we keep hearing that. I don't know how sure that is, but the poverty rate here is high. So I don't think that's the place where we should focus more attention on. The government, for instance, in Abuja, that was 2002, there was a meeting among African countries where it was decided that 12% of the country's budget should be towards health. Nigeria has not adopted it since 2002. And we've seen a consistent decline. This year, 2019 budget, it was 3.9% given to health. So when I say health financing is really poor here, it's like health is just one other sector. So I feel the government should increase financing of the health sector, the primary health care center, the NHIS. Are they, even as people are giving whatever they're giving every month or donating, how are they, what are the structures to make sure
Well, do you think we would have a stronger coverage of the NHIS? Now, Dr. Alani, I would like you to weigh in on that. Do you think we would have a stronger coverage of the NHIS if it was made compulsory?
Well, to make it compulsory may be stepping into people's boundaries, you know, enforcing them or pushing them to the wall. Let's look at the structures on ground. Primary health care, secondary care, and tertiary health care. Now, these three starters have been designed to cater and care for a certain group of people and a number of people. Unfortunately, when planning, you budget the next 10 years, what will happen? What will the population be like? What kind of diseases are we going to likely see? Are we doing what about our environment? Our drainage is okay? What's the next step? What are we going to do about air pollution? Our industries, are they going to be located in certain areas? If those are not factored in, then you're inviting chaos. And I think that's what happened. Yeah. If you have 3 primary health care centers in each local government or LCDA, let's break it down, and you have a minimum of 1 secondary center in each local government, and you have just 1 tertiary hospital catering for a population of about 18-20 million, then you know that the services will be poor or will not meet up the certain demand. These facilities will be overutilized, and you have issues of lack of bed space all the time.
Now, just within this year as well, still looking at the scope of this discussion now, we had sharp numbers when it came to individuals who have been struck with Lassa fever. Just a few years back, we saw what happened with Ebola as well. But let's still go back to Lassa fever, because that's still the major disease we are dealing with right now. Tuberculosis has relatively gone down, but Lassa fever is the biggest threat so far and kills pretty much fast. Now, Ondo State, as at January, had no less than 60 people so far confirmed had been affected, and it takes about 1.2 million naira to deal with such a situation. Now, do you think the state government, if you have 60 patients, do you think, for example, Ondo State would be willing to just dole out 60 million naira plus to cater for these individuals? When we are talking about financing, then possibly that lack of political will would have to be created some way, somehow, and then there's a will to address these issues.
Well, you see, we like this fire brigade approach. When you plan and you're supposed to put money down for something.
Lassa fever is in our face.
Yes, it is in our face. Until it's a catastrophe, then we have to now respond. That's when you see emergency funds being released easily. You understand. There's a certain fund set aside for emergency services, which usually is a blank check. Why? To manage a certain situation. But in order to prepare to handle it, there's a poor funding for it. So until it happens right in our face, then you see people doling out money for it. 60 million is just another money they could spend on adverts or any other thing. They can spend it right there. But to put 100 million or 30 million to prevent such may be difficult. Now, Lassa fever, just like you mentioned, what's our way of life? What's the culture? You see people in these areas that still have to dry their gari on the ground, bare floor. Rats will go there and eat, or will poo in it, or pass urine on it. And then ill-prepared, put it in water and you drink, and something could happen. So if government could in a way reach out to people, health education, which is key, change our orientation, and we, the people too, should be enlightened in our own little way. You know, we should be receptive to what changes that come into place.
Okay.
Then probably it will work out for us.
I want to take you up on this. The Ebola era, there's so many things. Oh, bathe in salt water. Oh, do this. Oh, do that. And that loophole was created because of lack of orientation. Yeah. We didn't have enough doctor presence. I'll tell you what, then I was on the radio. We had to keep calling doctors to come on the show and explain to people what to do, what not to listen to, instead of having a synergy, instead of doctors just showing up to say, hey, this is what we want to do, we want to come every other day. We had to go begging. So again, the people really, if they listen, because I'm sure, I mean, the average Nigerian goes to the hospital, doesn't say, I want to see a nurse. I want the doctor. Once you wear a lab coat, you're a doctor. Yeah. So I think that automatically the Nigerian would want to hear a doctor if a doctor says, don't do this, don't use this and that. So why hasn't there been that synergy? Again, for the Lassa fever also, they came up with all sorts of things. I remember during the time in the South where people were running and taking their children from schools because they had soldiers were going to go and immunize their children, and they'd never heard of it, so they thought that it was some form of insurgency. Why are doctors not out there in the field, or giving the information? Do we really have to wait to come to the hospitals for this synergy or orientation to happen?
That's a very brilliant question. But how would you feel if you come to an hospital, government hospital, where there are only 5 doctors serving about 600 people, and they are not on seats? They want to go on radio station to talk.
But all doctors can't be at all radio stations at the same time.
I'm just saying, that's just one example out of so many. Do you understand? We're overworked. Put it that way, we're overburdened. In the ratio, you have 5 patients to a doctor in a day. How would you feel you come to an hospital to see a doctor and you spend 1 hour, 30 minutes talking everything about your life? It's gone beyond treating your disease now. What we do now is biopsychosocial. We'll take care of the disease, we'll address you mentally, then your social environment, we get to talk about it. So if I spend my time doing that, there will be less time. It's no excuse, actually. It's no excuse, because there are some other doctors that are trained in healthcare financing or healthcare education. There are others that are trained to do that. But we're very few.
Well, do you think if we should have a breakout, because when we look at the spread of Lassa fever now within the border towns and border communities, it has spread along those lines now. Lagos is not so far-fetched from those states. The rest of the country is just borderlines that we are threading on. So do you think we will be prepared to face an outbreak one more time? We're still in the first quarter and hundreds of people have literally died. Compared to the results we had last year, do you think we can still take any other shock? And in the next 4 years, what should we be anticipating when we're looking at breakouts?
Now, it's a pity that many have lost their lives in this chaotic situation. But I can tell you that a state that is prepared will receive less shock. You can't be over-prepared, and you can't be under-prepared. But once you're prepared, definitely you'll be anticipating things to come in. In the role of disaster management, it's a vicious cycle. Okay, you anticipate a threat, you prepare against it, you respond when it comes to be, and you rehabilitate people when they are affected. If I tell you that this state, Lagos State, has already prepared this for over more than 15 years. They've employed disaster managers and gone into the books. That's why Ebola could be curtailed at that point in time. It will be difficult for, we have other little things that could affect the states, like cholera and all the rest.
Malaria?
Malaria, that's all those are endemic in there. But the issue there is our environment. But things that are foreign to us, we respond faster to it because there's already a framework of action that people just key into, trained personnel key into, and it's a similar situation. So this state is actually prepared for the next 4 years, I'm very sure. But states like Ogun State and Ondo State, yes, Ondo has a framework too. I'm aware of that because I have a colleague there in the state house there who has already implemented certain things. And Ogun State, I'm not really sure about Ogun State, but that's the gateway state to Lagos. Anything that affects Ogun State is going to affect Lagos State.
Definitely, automatically spread here.
Chairman, now let's also talk about cancer treatment as well. Cancer is a language that almost everybody understands because one way somehow somebody has lost somebody, is losing somebody, or will lose somebody to this disease. What level of research should we be doing? What level of assistance should we be looking at when it comes to treatment of this disease, and how much really does it really cost?
Okay. So when it comes to cancer, I like to say cancer it's a mad disease. It has a mind of its own. So it's not, I think the approach to cancer shouldn't be focused on just curative, excellent. I think we should focus more on the preventive aspect.
We understand that
So
we have
early
various
detection.
forms of
Yes,
cancer,
they are
cervical,
various.
breast
Yeah,
cancer.
because one of the worst things you want to tell anyone is that they have cancer. Like the reaction, even you as a doctor, you never get used to it. So when we were taking into perspective Nigeria, we're a developing nation, and we're trying to put into place curative measures. We're still trying, and we can see that the treatment and population ratio, there's a wide gap.
But putting it vis-a-vis, let's look at HIV/AIDS,
Okay.
malaria, cancer.
Okay.
How different are these other diseases from cancer, really?
Cancer. Okay, how different malaria, HIV, cancer?
The concept, the mindset, the treatment.
Okay, firstly, I would say one thing that stands is education, awareness. The average person knows malaria because it's endemic to us. The average person, you've heard about malaria, you have an idea of what can prevent, what can cure. Even though, you know, we are Nigerians, most people see the hospital as a last resort. The average person will just walk to the chemist and tell you, this is what I want.
Or go to church.
Oh, thank you. Or go
So
to
what's the awareness, what's the rate? How many cancer centers do we have in, let's start with Lagos, this is our primary place. And how aware are people of these cancer centers where they can go get tested and get the right test? Because I did ask the doctor that was here, I said, there's so many people who are in Enugu, Calabar, and then they can't get the proper test. So how aware are people of these cancer centers?
Okay, so I'm a health educator. That's what I do. So in interactions with people, I found that most people don't know. They just hear cancer, they go to church, and they go and prepare for the next level of what they just cancer. So health education, there's this gap. When it comes to the number of screening centers, you have the government-owned centers, you have private-owned centers, you have NGOs, okay, coming up, because as we go, there are a lot of centers coming up. So we have the teaching hospitals, we have the government hospitals, we have LASUT, and we have these two majorly, I will say, they have okay. In LASUT, we have a radiotherapy machine, and recently, sometime this month or last month, I think one of the high definition machine was brought to Luth, and we celebrated it. That's a great step. But in Nigeria generally, we have just 3 radiotherapy centers.
Wow.
We're about how many million Nigerians? 200 million Nigerians. So we have 3 radiotherapy machines to 200 million Nigerians. What is happening is this. We have these 3 radiotherapy machines are quote and unquote functional, because you hear today, our machine broke down, no, go to Zaria. Zaria will say, are you just coming from Abuja? We just sent some of our patients there, and I'm coming from Abuja. So this lapse in therapy is what makes people decline, because I believe in the ideal environment, if we have enough radiotherapy machines to go around, if we have enough cancer centers to go around, of which we have very little, even if we want to divide it into sectors of Nigeria.
It's not enough.
It's not enough.
All right, gentleman and lady, we'll quickly want to round this up, but I'm going to come back to you, Dr. Lani. As we go to the elections, of course, people are voting for different candidates for different reasons, but what would you want whoever emerges to prioritize in the healthcare department? I know that there's also infighting in the health sector, Johesu versus NMA, and all the drama that comes. Why should the medical director be a member of the NMA? Why shouldn't he be a member of Johesu? And all of those problems. What should be prioritized so we can reduce the number of strikes that we have year in, year out? It's become like a sing-song, sort of.
That's a heavy...
Just keep it short.
Yeah, that's a heavy question. Because if you need to do the analysis, you can't read someone's mind, people will talk, just like you said earlier, the political will matters. If a government is going to come into town, they need to have a working paper, a working framework of action. Call these bodies together, okay? Let them give you a white paper. Excuse me.
Okay.
Let them give you a white paper, something to prepare and work on. Issues of healthcare financing matters, technology matters. Then we're going to put into place.
Sorry about that.
Yeah. Excuse me, I'm choking. Then we have to put in.
Okay, well, Dr. Olani, we'll just let you have a quick break.
She'll just conclude for us. Choma, so what would you be envisaging that the government who's coming in, being that there's going to be a change quickly, what do they need to do?
Okay. For me, focus on NHIS, making NHIS work. Then primary health care financing. Primary health care financing. It's very important. Then another thing I feel the government should focus on is training more community health extension workers. Not we have to be ideal. I think every sector or every country should work with what goes for them. Yeah. So training of community health extension workers to assess those areas where maybe the doctors might not be able to reach, and then we also need to work on our referral system. Know what is beyond you, and know how to
refer to someone else. Well, we want to thank you guys because we have to quickly go. Dr. Olani Ayodiji, medical practitioner, and Choma Wakama, founder Smile With Me Foundation. Thank you for speaking with us. Sorry about the cold. The flu is everywhere. We'll have to take a short break, and when we come back, we're talking about other sectors of the economy, and you don't want to miss it. Stay with us.
Definitely.